Thank you, Susan. Right, so earlier, Wei Xuan, you mentioned that it is still meaningful to discuss well-being even in persons with mental illnesses. So for this group of people, can we do more to promote their well-being?
Yeah, actually, we already have, we're trying to do more. We definitely can do a lot more. I think the first thing, as I mentioned earlier, we are starting to be more aware about the physical health status of persons with mental illnesses. Various causes explained earlier. So the government has recently announced that we're going to push more mental health services into the community, into polyclinics. 1 in 2 polyclinics will have mental health services embedded in them. So on the one hand, it looks like this initiative is to increase access to mental health services. But the way I see it is it also has a beneficial effect on helping to take care of physical health of persons with mental illnesses. By co-locating mental health services with physical health services, we basically house all healthcare services under the same roof for persons with mental illnesses. So when they go to see their psychiatrist for mental health conditions, the psychiatrists can very quickly refer to their physical health colleagues, primary care physicians, if they're worried about the physical conditions of these patients. And with this co-locating, I'm also hopeful that in the years to come, this effort can catalyze more coordinated healthcare for persons with mental illnesses. So that hopefully takes care of the physical well-being aspect. The other thing that I didn't mention that was found in the Singapore mental health study was that there's also this problem with a treatment gap that was picked up. So treatment gap basically refers to the numbers of persons with mental illnesses that are not receiving adequate treatment. And it also includes a delay between the onset of the illness to when they actually receive professional help or treatment. So in the Singapore mental health study, it was found that only 22% or 1 in 5 persons with a psychiatric illness has actually consulted a psychiatrist. And around 18% only has seen a general practitioner. So all in all, we're looking at maybe less than 50% having actually consulted medical services. In terms of the years to treatment, the delay, something like 4 years before a person with major depressive disorder actually gets help. 9 years before someone with OCD gets help, and something like 13 years before someone with alcohol abuse actually seeks help or receives help. So I think this is a very significant issue and a big concern for us. The reason being that for a lot of mental health conditions, the earlier it's picked up and treated, the better the prognosis, the better the chance that the symptoms can remit, the better the chance that the patient's potential can be regained. So with such a long gap to treatment, sometimes when patients finally present to the healthcare services, there's not that much that medications or other interventions can achieve. So the other aspect which I think we want to focus on is to actually shorten this treatment gap or to minimize this treatment gap. And other than pushing mental health services to polyclinics, the government has also recently announced that it's going to step up public education efforts on mental illnesses, mental health conditions. Also going to build capacity amongst frontline service personnel in HDB, in NEA, I think also in the community partners, VWOs, to help to screen for mental health conditions. So with more screening, hopefully there will be more persons referred for assessment, earlier diagnosis, and therefore early treatment. And I guess another major issue is stigma of mental illnesses. In my personal opinion, I think the stigma associated with mental illness is probably the single most damaging factor for patients suffering from these conditions. And the government is also increasingly cognizant of this issue of stigma. And also, again, in the recent budget announcements, I think there are plans to increase inclusivity for persons with mental illnesses. Specifically, the National Council for Social Services will be tasked to look at ways to integrate persons with mental illnesses better into the workplace and into the community at large. And I guess the last point, very small point there, the government can come up with all these initiatives and efforts, but I guess end of the day, a lot really comes back down to you and me. Can we be more understanding, more supportive, parents, children, colleagues, siblings? Can we be less judgmental? I think this is what I feel is the missing piece in this puzzle of helping persons with mental illnesses achieve greater well-being.
So I have only one last question for the panel. So that is, are there any policies that may help to foster an environment that promotes the citizens' well-being?
Yeah, so I guess, I have some ideas, or just based on my reading of the literature. One factor is education, I guess. Like, it's been proposed, like, some of the happiest countries in the world are the Scandinavian countries, which are the countries in Northern Europe. And some people have argued that, they have these social welfare programs that are important, but their education system is also focused on leveling the playing field. So basically, if you look at the educational achievement of students in these Northern European countries, there's a lot of focus on closing achievement gaps, so that the parents' own educational attainment tends not to predict the educational attainment of their children. And I guess education is important just by it increases people's life choices, right? Like if you have an education, in theory, there's more options available to you in terms of what you can do with your life. Whereas if you don't have an education, then you're much more limited. And so having more life choices is important for well-being, I would say. And then based on the research, economic inequality is associated with less well-being, especially for, they've done these longitudinal studies in the US, for example, where they look at the level of economic equality over, a period of like 3 decades. And what you see is when economic inequality goes up, well-being goes down. And the reason for that, or one of the reasons for that, is that the more inequality there is in a society, the lower the levels of trust are, right? Because so when you see a bigger gap between the rich and the poor, people become a little bit more distrustful of their society in general, because there's this perception that, that things are unfair. And the lower the levels of trust are, then the lower the levels of well-being, because, not being able to trust the people in your society is going to affect the way you conduct yourself on a day-to-day basis, right? And there's an interesting study a few years ago showing that looking at all these countries around the world, looking at the level of progressive taxation. So do the rich get taxed more than the poor, right? So the more progressive the taxation is, which means that yes, the rich get taxed a lot more than the poor, you find that people in these countries tend to be happier. And one reason for that is that people living in these countries where there's higher progressive taxation tend to be more satisfied with public goods. So they tend to be more satisfied with transportation, education, healthcare, things like that. And so the argument is that, by taxing people progressively, I guess the government sort of lessens the burden on poor people, right? But at the same time is able to recover the resources to pay for services that basically everybody in the society needs, right? So, and I think, Singapore is already a country that does progressive taxation, right? And I would say another important area is, like I've been saying before, is social support. John Helliwell is an economist, and so he argues that, if you think about the financial crisis of 2007 and 2008, these countries, Iceland and Ireland, they suffered huge economic losses during this time, but the levels of satisfaction in these countries were still pretty high during the crisis. And he argues that when you look at the survey data on these countries, right, Ireland and Iceland, people in these countries, they report high levels of social support. So his argument is that the reason why people in these countries were able to maintain their well-being despite the economic crisis is because they had people that they could count on during this stressful period of time. And so I don't have any specific policy recommendations, but if there are policies that we can implement that make it easier for people to give support to one another, right? I think earlier, paternity leave, for example, maternity leave has been expanded, right? I think that's a step in the right direction. Wei Xian mentioned caregiver burden. I think I think more attention needs to be paid to the mental health of caregivers, right? Like it's a very stressful situation to have to, go to work, but then take care of a aging parent, right, who's suffering dementia. I think there's more attention being paid to aging research, which I think is really important. Active aging programs are actually really important, not just because of the caregiver issue, but also because it's really like if we can help seniors maintain their health, they could be more involved in taking care of their grandchildren, which is good for the grandchildren as well as the grandparent, right? It is sort of like making these relationships possible. So I mean, I think policies to improve social support, whatever can be done, I think those would be really important for improving well-being.
Thank you. Right, so now we still have a bit of time left for questions. So any questions from the audience?
Hi, thank you very much. I just want to know, right, I have a very burning question here that I would like to ask the panelists to address, right? So, for example, you shared about the World Happiness Report and how Singapore was ranked, whatever. And yet, in your definitions, you mentioned that happiness is a positive emotion that is a subset of well-being. And even Susan also mentioned that happiness differs across cultures. So why are we using these terms so synonymously? So for example, right, like I'm very happy that my students are here attending this talk, but it has in no way impacted my well-being, right? And yet at the same time, we're always using these terms so interchangeably that it's very misleading. And that's the reason why when we say like, oh, Singaporeans are the happiest in Asia, people ask, are we truly really happy? So could you explain why do we use these terms so synonymously?
Yeah, I think it's a good point. I think that's like scientifically why we have this construct of subjective well-being, right? Is to specify these different components. And actually, myself, I usually try to be pretty careful, like when I'm communicating these differences. And I do think that it is important. When we're ranking countries, that doesn't get said enough. When we talk about the happiest countries in the world, usually they're not really focused on the positive emotions that people feel. But I guess that, the reason why I guess like a lot of researchers and I guess the panelists, you can count us as guilty as well, is communicating the findings to the public. Sometimes you have to find a common ground in terms of language, right? And when we talk about well-being, sometimes, well, a colleague once told me that when he hears well-being, sometimes he thinks of like wellness and spas and like therapy and and so sometimes it's easier to start off with by talking about happiness and then saying when I'm talking about happiness, this is what I actually mean. So I think that's part of the problem is always trying to communicate some of the science to the general public, or trying to attract the interest in the first place, right? Like if you say like, I'm researching what makes people happy, then that brings a lot of people on board because it's sort of like, oh, I'm interested in happiness. But if you say, I do research on well-being, they're like, well, what's that? Like, are you trying to start a spa? So I would say that's part of it. It's just a communication thing, but I agree. It's important to be careful with our terminology.
Do we have another question?
Yeah, so my question's on the national measurement of happiness. Do you think that Singapore, her government or her people are ready for a national indicator of well-being? And if not, what's stopping this?
I think increasingly there are more and more countries having national indicators of happiness. So right now we don't have a national index of happiness yet. But even so, there are still international surveys like the Gallup World Poll, which is being conducted almost yearly. And that actually gives us pretty good measures, a good sense of happiness or well-being in Singapore. So it has a measure of life satisfaction, the latter item. It also has a few items measuring positive feelings, so positive emotions, and negative emotions. So it pretty much covers subjective well-being. Yep. So, but of course, I mean, if you want a sort of a more unique culture-specific index, that would be even better. So we would be able to better understand, what are really the issues that bother Singaporeans or pertain to us that may not be captured in these international surveys. So I would think that yes, it is a good way to go if we could eventually in the near future have such an index, in addition to all the international comparisons that we currently have.
Yeah, I think the society is ready for an index. I think there are already surveys showing that a lot of Singaporeans are concerned about work-life balance. And like one way to tap into that is to measure their well-being. But I think Susan's research is important to understand that different segments of the communities here may understand this concept differently. So there's a lot of work that has to be done to make sure it's rigorous. So I think I agree. Like the Gallup World Poll, these surveys are helpful, but I think it will be helpful for Singapore itself to develop its own measures so that they can be sensitive to these language differences.
Yeah, hello, I'm Ryan. Okay, I was just wondering, is happiness actually absolute or relative? So I'm not very good with examples, but since wealth is determined to be one of the factors, so I would say an example. Let's say we put the same average Singaporean for 1 week together with a group of very rich people, and then or in a very rich country where the people around him are relatively more rich than him, and then afterwards we put this same person for a week with in, let's say, Africa, or with some people, or with a group of people who are relatively poorer than him. So will he, because his well-being is the same, like he's in the same state, but will he be more happy in the second week, much more happy, because when he compared relatively, so he felt more happy in the second week compared to the first week? Or is actually happiness just a choice? Like people always say, like, you count the roses instead of the thorns. So, yeah. Thank you.
There's different ways of looking at that question, right? So first of all, social comparison. People who tend to compare themselves with other people tend to be less happy. They actually did the study of like on an airplane, and so they look at, like, when you're on an airplane and you're in economy, and to get to economy you have to walk through first class first, right? Like on those kind of flights, they find more incidences of disputes and complaints that get registered and filed at the airline, compared with flights where if you're in economy, you have a separate line and you just go into the economy section. You don't see the, right? And the argument is that if you have to walk through the business class or first class section first, and you see like the nice silverware and the wine and all the spread that they have, like, you're engaging in social comparison, and that makes you really unhappy about your seat, next to like this kid who is like screaming and not being very cooperative. So social comparison in general has a negative effect on our well-being. And whether you do it temporarily or whether you do it habitually, it has a negative impact. But your question is interesting in the sense that, you pose this idea of, like, being among a bunch of wealthy people versus like being in a poor country. And there's different ways to think about that. I think, yes, if you're sitting in a room with a bunch of rich people and they got all these luxury products, and you've got your Samsung Galaxy from like 4 years ago that you're still using. I'm using a Samsung Galaxy for 4 years ago. That's why it's time for me to get a new phone. I think in that situation you'll be unhappy. But there's a different way to think about that question, which is, suppose you're making suppose you're making a lot of money, but you live in a wealthy country so that there's a lot of rich people there. versus you make a lot of money, but you live in a poor country. So you're wealthier than most of the people that you're in the country with, right? So the question is, which person is going to be happier? Like, if it's about social comparison, you should be happier in the poor country because you're the king, right? I mean, you make so much money than everybody else. Whereas in the wealthy country, there are all these billionaires, and you're always looking up to them, and you're going to be depressed. But in reality, if you look at the survey data, like, everybody's generally happier in a wealthier country because it's more stable, it's safe, it's secure, right? You can make a lot of money, but if you live in a really poor country where there's a lot of instability, a lot of crime, a lot of violence, then yeah, you make a lot of money, and you can build a mansion and build huge fences to keep people out. But that's not as great a life as if you're living in a more stable society, right? So it's a tricky question. I mean, there's different ways to answer it, I think.
So other than social comparison, actually, we found that national wealth actually has a big impact on people's level of life satisfaction. So for the rich, living in a rich nation is obviously beneficial, but living in a poor nation, so for a rich person living in a poor nation, he's not going to be as happy as living in a rich nation. But then what about a poor person living in a rich nation, or a poor person living in a poor nation? So who do you think will be happier? I mean, you're poor anyway. Like, so you think that if I live in a poor country, social comparison, like everyone else is equally poor, so I won't feel so bad rather than I live in a rich nation where everybody is better than me, I'm the only poor chap around. Right? So what we found was that even for the poor people, living in the rich nation is better for their well-being, for their life satisfaction. So it's because of superior societal conditions. So we have better infrastructure, better health care, safety. Yeah. So that actually makes a bigger difference.
I've been to Bhutan, and Bhutan is considered not a very rich country, and they have a national gross happiness commission that measures happiness. So I'm not sure whether you've done any comparison with the parameters they use to measure happiness versus what we've seen today about the survey you talk about. Bhutan, yeah.
Explain from a non-expert or common sense of, as I feel that, the culture plays a difference, right? I mean, as we all agree that culture plays a difference in people's interpretation of happiness. So for Bhutan, it's a country that I would think is more collectivism inclined, where the interpersonal relationship matters more. And then the relationship there, I feel, is simpler as compared to a materialistic country or economically developed country, or more complicated. So it seems that people there, without much comparison, and then maintains harmony within their own community, tends to be more happy. And that's my explanation from a non-expert.
Yeah, I'm not familiar with the specific indicators that they use in their index. I understand that they are engaging survey data collection, so I think that's important. And I think that as long as they're asking people, as long as there's a separate question where they ask people, how satisfied they are with life, or they ask people to evaluate their life, then whatever other questions they ask, there's at least a way to evaluate, you know what I mean? Like, are these things actually related to people's well-being? So whether it's like, how much tourism there is in the country, whether it's, like whether they were starving in the past month or anything like that, like, I think it's fine. Like, I think each country can define for itself what they think is important for the well-being of their citizens. The main thing is to ask the citizens, like, how satisfied they are with life, how happy they are with life, so that you can triangulate these different indicators, right? I think because at the end of the day, that's why it's called subjective well-being, because it is the person's own perspective on their life and living conditions. So whatever a government or a society thinks is important for people's well-being, they definitely need to ask the people themselves how happy they are with life or how satisfied they are with life, so that they have the data to see whether or not it matters.
I think the index that Bhutan uses includes many dimensions, so I don't remember all the dimensions also, but it even looks at sustainability of the environment, education, and I think it also has a life satisfaction item. So that's their gross national happiness index. But they were actually included in the Gallup World Poll as well, so that means that there is data on Bhutan in terms of life evaluation in the Gallup World Poll, and Bhutan actually ranks pretty low, I think in the in the 80s or 90s in recent years. Yeah. All right, I think we have time for one last question, and then that's it.
Hi, my name is Juming. I think I want to go back to the ladder diagram that shown. Okay, I think when a person climb higher, correct? The ladder, yeah. Okay. When a person climb higher, I think you will have a greater responsibility, correct? Okay, how can we manage this high expectation to be happy and to prevent any disorder? Do we have any framework or any structure steps that we can follow actually?
So your question is about managing people's expectations? Yeah, that's an interesting question. Yeah, and I guess you relate this to the latter because it looks like manage their expectations, basically.
Yes.